One of the challenges in treating patients with nasal polyps is that they do have a tendency to come back over time. We need to use nasal steroid sprays or nasal steroid sinus irrigations to target the inflamed tissue deep inside the sinus cavities. But even with those things, sometimes it's not enough. Fortunately, we have a new device. It's actually a medication called SINUVA. And SINUVA is a medicated implant coated with mometasone. Mometasone is a special type of steroid that's absorbed by the sinus tissue quite easily. And in a time-release fashion, over 90 days, this implant will slowly deliver the steroids directly where that patient needs it the most. I tend to use SINUVA on my patients who have had prior sinus surgery, are over the age of 18, and when I start to see polyps recur despite doing the traditional medical therapies. The procedure to place the SINUVA is generally quite easy. It's just done in the clinic exam room. I use a nasal endoscope so I can see exactly what I'm doing, and I gently numb up the nose, usually with some numbing sprays or some numbing gels, and then I place the implant right inside the nasal cavity, right into the ethmoid sinus, directly where that patient needs it. Sometimes if the polyps have grown too large, I'll either give them a course of oral steroids like prednisone, or I can do an in-office polypectomy where I gently remove some of the polyps to create more space for the SINUVA implant. The procedure is short. It only takes a few minutes to do on each side, and it's usually tolerated quite well. A very well done research study showed that with SINUVA, it significantly decreases the size of the polyps, it improves nasal congestion, it improves the patient's smell function, and more importantly, many patients feel that they just no longer need revision surgery compared to before the SINUVA implant. I'll generally see patients back about 3 months after placing the SINUVA implant. And at that point in time, I'll make a decision based off the patient's symptoms and how well they look under nasal endoscopy. If I see the polyps under good control, I may give it a few more months until I see them back. If I see the polyps smaller but still significant, I may recommend another SINUVA implant within the next 3 to 6 months. Overall, it's a very nice non-surgical way to control these challenging nasal polyps, and it has decreased my revision rate of doing sinus surgery on patients with nasal polyps. Most patients who have it are very happy and know within a week or so that the mometasone drug is doing its job directly where it needs to be.